Hi, everybody. It's Brian Meek from KMU. I'm here today to talk to you about the coronavirus and provide some safety tips and safety topics specifically for utility workers. There's a lot of information out there right now about how we can protect ourselves in everyday life, but the fact that we are considered essential workers and we have to actually go to work, I thought it'd be a good idea to talk about some of the things that we can do while we're at work to help prevent the spread of coronavirus. So today we're going to be using the KMU Common Sense Safety Model. And for those of our regional training group and safety compliance and management cities, you're already familiar with the idea of defense in depth with the KMU Common Sense Safety Program, but we're going to use that today in order to assess the hazard of the COVID-19 and the coronavirus and ensure that we can take the necessary steps that we need to prevent its spread and prevent us from getting sick. So when we think about the 5 steps or the 5 focus areas that we look at with defense in depth, we talk about training, we talk about hazard analysis, situational awareness, processes and procedures, and PPE. And all 5 defenses will really help us prevent this spread of the disease. So with training, right, you're getting a lot of training just from everything that you see, all the public service announcements on TV, the radio, everything that you see on the internet talking about washing hands, maintaining good social distancing, trying to stay away from potentially infected people. All of that has provided a great amount of training. And we at KMU are going to continue to provide you the training that you need through updates like this. Also through our website, kmunet.org, we have a COVID-19 update page that we keep updated regularly. So we are going to continue to provide you with the knowledge that you need in order to try to stay safe. So really today, what I want to focus on is how to do a hazard analysis on the COVID-19 issue, how to maintain situational awareness, and then what process procedures you can follow and PPE. So the first thing that we need to understand is how is the virus transmitted, right? So when we're doing a hazard analysis, we have to understand what is the risk. And in order to understand the risk, we have to know how the virus is transmitted. So according to the CDC, the virus is spread by person-to-person contact. It's thought to be spread mainly through this person-to-person contact between people who are in close contact with one another, about 6 feet. And that's really where the 6-foot social distancing rule has come from, right? It also comes through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouth or noses of people who are nearby and possibly be inhaled into the lungs. And that is why we say 6 feet. So those droplets that are put into the air or the droplets that are transmitted to your hand, if you wipe your nose or your face, then you shake hands with somebody, the virus then goes from their hand to your hand, and then you touch your face, and that's how the virus is transmitted to your body and into your respiratory system. So a lot of people ask, can someone spread the virus without being sick? And this really affects the risk, right? So people are thought to be most contagious when they are most symptomatic, the sickest. So if you're coughing and you have the fever and you have all the symptoms and you're positive, that's when the scientists believe that you're most likely to spread the virus. However, some spread might be possible before people show symptoms. There have been reports of this occurring with this virus, but this is not thought to be the main way the virus spreads. But it's important to know that it is possible, right? It's also possible that it could be spread from contact with contaminated surfaces. A person could get COVID-19 by touching a surface or object that has the virus on it and then touching it with their own mouth, nose, or possibly their eyes. This is not thought to be the main way that the virus spreads, but it is again a risk that we need to take into consideration. So a few years ago, there was a pretty good research done, I believe it was by MIT, where they used high-speed cameras to capture somebody sneezing. And at the time, they were talking about the flu and how the flu was spread. So they used these high-speed cameras to look at the spread of how far those water droplets go. And they looked at about 100 sneezes from 3 healthy subjects, and they photographed the split second when the sneeze hits the air to just when the droplets end up. And they found that instead of some sort of uniform cloud that was created, a single sneeze would actually fragment in the air similar to paint being flung on a canvas. So think about that. If you're standing in front of somebody who sneezes, all of a sudden there's not just this big full cloud there. It is actually like somebody splattering you with paint. So if you're close or far away, it doesn't really matter because you're going to get splattered. You got to keep that into consideration when we're thinking about the hazard and assessing the risk. So remember, what is risk, right? Risk, we look at the severity and what is the capability that it's going to happen. Well, in this case, with people being, people can be infected from 1 to 14 days prior to showing any symptoms. We really don't know if people are infected or not. So we have to take in consideration and just think that everybody could possibly be infected that we come into contact. That's the most conservative way. And then when we look at the other side of risk is what is the severity? Well, right now there's about a 2% death rate in the United States, between 1.5% and 2% death rate of known cases, right? That's pretty high. If you think of all the things that you do in a day, if you were to say that I have a 1 to 2% chance of dying, you'd probably try to avoid every single one of those. So think about it that way, right? What is my risk? If I contract this disease, I potentially could have up to a 2% chance of dying from it. So we know that there's risk there. We know that there's a possibility that we could get it. So now what do we look at next when it comes to hazard analysis? We have to look at, just like we would for any other job, what tasks do I do that put me in direct contact with potentially exposed people? Think about what you do every day, whether you're working in a bucket truck, whether you're working at the water plant, even doing pre-job briefs, right? What are all the things that you can do? And make a list. You could use the job hazard analysis form if you'd like, or just make a list of all the things that you or your workers do every day that you're directly in contact with somebody else. And that doesn't mean some random person. That means a coworker also, right? So it's not just a random person. It's when am I in contact with somebody else, okay? So think about how we mitigate hazards, right? We're not going to be able to eliminate the hazard because we don't know who's sick and who's not sick. We can't eliminate the virus. We have to assume that it's there. So now we have to take the steps to mitigate the virus. And when we do that, we're either going to take engineered controls or administrative controls, right? So when we think about pre-job briefings and things like that, what are some things that we can do instead of meeting as a big group where we're all huddled around either a procedure or we're huddled around a pre-job brief document or even a computer? How can we change that process to reduce our face-to-face contact? Maybe we can spread out. We can have multiple pre-job briefs. We can use radios or cell phones, all different ways that we can spread ourselves out, right? How about using a digital system for recording job site briefings and allowing sign off on documents through a digital method, like through a PDF or email, rather than having somebody actually sign a document? One thing when we at KMU were evaluating our training was how many people touch a pen when they sign into an attendance sheet. So those are the kind of tasks that we look at, and how are we going to prevent that? And what steps are we going to take to prevent that spread of going from each person's hand onto that pen and then back onto somebody else's hand, right? So have your crews muster in different locations in the morning, things like that. Sanitize touch points on tools after uses. So if you share tools and you can't have a separate set of tools for different people, sanitize those tools after use. Make sure you're using lots of hand sanitizer, just like they say for everything else, right? So there's lots of different things that we do. Working together in a bucket truck. What are you going to do when you're in a bucket truck with another person, or you're doing line even with 2 buckets, and you've got 2, 3, 4 people all within a close range of each other? Think about that. Somebody sneezes, where's it going to go? Are you downwind of that person that's going to sneeze? You can't really move out of the way. So what precautions are you going to take? And it's going to be different for different people, right? But our goal today is to get you thinking about these hazards and how you can mitigate the hazards. Same with working in the water plant or any other enclosed environment. If you are doing anything that requires 2 people, think about the distancing that you are from each other. It's very easy to transmit this virus if you're in close contact in a non-ventilated area or in a small area where the atmosphere doesn't change out very often. You can have significant issues there or increase the spread there. So just be thinking about all the different jobs that you do and what those contact points are. Then change your processes and procedures, right? So we talked about making sure you have the good hazard analysis, having good situational awareness when you're out there. How close are you to those people, right? What way is the wind blowing? All of those things when you're working in close proximity. And then the last thing, besides situational awareness, is procedures. So once you come up with these methods, alter your practices and your procedures to make sure that everybody is following the right precautions, right? If you have a really good idea and you're doing something to protect yourself, make sure you share that with everybody else. Get it institutionalized so that everybody can then be following the best practices and procedures. Then the last item is PPE. One thing that I want to make sure, because there's a lot of talk about respirators out there and using face masks and respirators, remember that in order to use any kind of respirator, right, you still have to follow the OSHA regulations. So you have to make sure that you're selecting the right type of respirator for the job that you're doing and for the hazard. You have to make sure that anybody wearing a respirator is fitted properly and periodically refitted as applicable, and that they've gone through your respirator qualifications. So that means getting signed off by a physician that they're physically capable of wearing the respirator, that the respirators are regularly inspected, maintained, right, and replaced as necessary, or disposed of if they need it. So if we hear about the N95 respirators that are in such high demand right now, right? Those should be used if you're entering any place where you think that there is going to be somebody that is potentially affected by COVID-19 and you cannot maintain that 6-foot distances. That's a good recommendation that you could make within your city, right? Again, remember that you have to have been fit tested within the last 2 years. If you use this N95 respirator, you had to have been fit tested for an N95 respirator in the past 2 years, medically cleared and properly trained to use the respirator. A lot of times when we get into these situations, we don't think about how all of those requirements are still in place. The last thing you want to do is put on a respirator and have some sort of medical issue with the respirator itself, and end up doing more harm to yourself than you would have trying to avoid getting the COVID-19. So keep that in mind. You can review the OSHA respirators. 29 CFR 1910.134 talks about respirators and respirator fit testing. Again, that's OSHA 1910.134. So I just wanted to take a few minutes of your time today just to get you thinking about utility-specific things that you can do in order to protect yourself from the coronavirus, right? So going back to our common sense safety manual, or our common sense safety model, the hazard is the coronavirus, right? We want to prevent that from getting us sick or from dying. We want to use our 5 different defenses that we have there to do that. Maintain our training. Keep up to date on what's the latest thing that we can do, what they find out about this virus, and how we can protect ourselves from it. 2, do a hazard analysis. And anytime that information changes, like if they find out that there is extensive spread through contact with tools or contact with objects or food, you're going to want to reassess those hazards, right? So do a hazard analysis on your job and how coronavirus affects the job that you do. Maintain situational awareness when you're out in the field. Update your procedures and processes to make sure that they are consistent with what you're doing right now. And then make sure that you have the right PPE and that you're trained and cleared to use it. All 5 of these things, when used together, will really help prevent the spread of coronavirus. I hope you've enjoyed this few minutes of training that I've given you today. We're going to try to have a few more of these as the time goes and as updates come in. I appreciate any feedback. If you have ideas for other things that you'd like to hear, feel free to email me at bmeek@kmunet.org. And we look forward to getting back out into your cities and helping you out again in the near future. Thanks, everybody, and have a good day.